Multiple births.
Whilst being exciting, it may come as a shock finding out you are pregnant with more than one baby. For many, this will be at the first scan. You'll have lots of questions and choices ahead of you that you may not have anticipated. Don't worry. Your midwife will support you to develop a plan of care that is suitable for your type of multiple pregnancy.
Types of twins. Dichorionic diamniotic twins are not identical. They have their own placentas and sacs. Monochorionic diamniotic twins are identical. They share a placenta but have their own sacs. Monochorionic monoamniotic twins are identical. They share a placenta and are in the same sac. Before 16 weeks of pregnancy, the specialist team will meet you to talk about when you will be seen and who you will be seeing. If you are pregnant with more than 2 babies, the team will explain what type they are. In some circumstances, you may be referred to a different hospital with more advanced facilities.
What will my recommended care be? When you are having more than one baby, the only accurate way to ensure they are growing well is with ultrasound scanning. This will be offered to you at regular intervals throughout your pregnancy. This is to ensure your babies are growing equally, to determine their positions to help you decide how you would like to birth them, to check the blood flow to each of your babies, and to make sure they are growing well. Try not to compare their size to any growth guides, as these are based on one baby in the womb. With identical twins, you'll be offered 2 weekly scans from 16 weeks. With non-identical twins, you'll be offered 4 weekly scans from 24 weeks. After each of your scans, you will see the specialist team, which will be a doctor and a midwife. They will explain the results of your scan and make a plan with you. Before 24 weeks, further discussions will be planned with you and your partner to make you aware of any potential risks and treatments. For example, premature birth. 50% of twin pregnancies and all of triplet pregnancies will be born before 37 weeks. Due dates are calculated as if you were expecting a single baby, so have in mind an earlier arrival date. You may be transferred to a neighbouring hospital with enhanced services if you go into labour prematurely. Signs of early labour. If early labour is suspected, the benefits of treatment will be explained to you, such as how we may help your baby's lungs function better if they are born early. We'll also explain when to call for advice or come in for review. Preeclampsia and anemia. Extra care will be taken to monitor for preeclampsia and anemia, as you may be at an increased risk. Additional blood tests and blood pressure checks are also offered.
Your birth. Identical twins in separate sacs are offered birth at 36 to 37 weeks if they remain uncomplicated. Non-identical twins are offered birth at 37 to 38 weeks if they remain uncomplicated. Identical twins in the same sac are offered birth at 32 to 34 weeks. Triplets are offered birth at around 35 weeks. At present, about 45% of all twins are born by caesarean, and triplets or more are almost always born by a planned caesarean birth. About 5% of all twin births need a caesarean birth for the second twin when the first baby has been born vaginally. In twin pregnancies, the position of your babies will influence what is recommended for you. A vaginal birth will be offered if the first twin is head down. A caesarean birth will be recommended if the first twin was not head down. Other things to consider are if you've had vaginal births before, if you've had caesarean births before, if there are any concerns for your babies found during scans, if there are any concerns for you.
A multiple pregnancy will lead to many choices and decisions for you and your family. Your midwife and the specialist team will be there to create a maternity journey that is personalised to you.
To find out more, visit sneewellbeing.org.uk/maternity.